patients in their 80s or 90s and say, how come you have so much arthritis? You don't have pain, your hands are moving well. And you know what they say to me? That they take a bowl of porridge every morning. Now, no, osteoarthritis is different from rheumatoid arthritis. Rheumatoid arthritis is an autoimmune condition, a disorder where the body begins to attack itself. That is different from osteoarthritis. Well, there's no known cause for osteoarthritis. You can't say this is what causes osteoarthritis. Rather, there are factors being associated with it. One is aging. As we get older, our joints begin to degenerate with time. That is one. Now, trauma, major trauma that affects the joint, especially if people have trauma that affects the surfaces of the joints. You know, when you have the way the joints work in a congruous manner, like somebody's bending the fingers, they work in a congruous manner. Now, if there is a fracture that goes through and affects the surfaces of the joints, it alters the way the forces pass through the joints. And that can quicken the breakdown of the cartilage and lead to osteoarthritis. That's another one. Another one is repetitive damage, repetitive trauma or stress to a particular joint. If you think from experience, people who do a lot of manual work like builders tend to have more wear and tear on their fingers. If you think about people who footballers or soccer players have more wear and tear of their knees, I guess to say. And that is overweight, being too overweight, carrying too much weight also is predisposes more to osteoarthritis. And there must also be a genetic predisposition to osteoarthritis. People come and they say, oh, my mother had bad arthritis. I say women because I think to be more prevalent amongst women. I think maybe gender is another thing. Just to have more. Women tend to have more than men as a whole. The usual symptoms of or the clinical features of osteoarthritis in the hands is like patients complain of pain. This is pain that gets worse with activity and reduces with rest. Some of them actually say something like being on holidays felt so good. Yes, because it's reduced activity. But when they go back to work, start doing what they used to do, the pain comes back. So that's one. And that was early morning stiffness. In the morning, they're complaining that it's like their hands become stiff. It's like it's glued. And over time, it's lubricated and gradually begin to get the range of motion back. So that's early morning stiffness, also common in osteoarthritis. Some patients come with swelling, or present with swelling and tenderness. Touch joints is very tender to touch. Another thing that is very common in osteoarthritis is pain at the base of the thumb. It's very common. Then this, especially in women, then there is struggle with things like opening the lids of jars, turning keys, things, any movement there's a talk to it. And even carrying weights, the hand feels weaker. There's so many things that complain because of pain at the base of the thumb. In fact, arthritis at the base of the thumb is almost a section on its own when it comes to osteoarthritis of the hands. Another thing it presents is the appearance. You can see with osteoarthritis, the appearance of the hands. Over time, they begin to develop knobbliness at the joints. In the farthest joint, in the middle joint, and this joint, they become knobbly because the body is trying to heal. The ones, they call them nodes, like the ones at the distal joint or this farthest joint is called the Heberden's nodes. That's the eponym to it. Then the ones is called the Bouchard's nodes. So, if an experienced hand surgeon, once you look at the hand of someone who has significant osteoarthritis, you would know. You don't even need to do an x-ray to find that out. The way I diagnose osteoarthritis, most of the time, is just from the history and from the examination. Some of the things I've mentioned, I complain about the pain, the swelling. You remember, it's a condition that has periods of exacerbation and remission. So, from the history of the clinical features we talked about, then from just examining the hands, it's quite obvious in some patients. The common investigation that one does, I do with osteoarthritis, is an x-ray. In x-ray, you begin to see the effect of the loss or the breakdown of this cartilage. For example, if you look at an x-ray, the space between the two bones is usually black in color or dark in color because it's cartilage, so it doesn't show. It's not white like bone on x-ray. When people have arthritis, over time, that narrows because the cartilage is being worn off. And also another thing they do, as the bone begins to touch bones, if you look at the joint, it looks a bit white. Close to the bone, the surface of the bone looks a bit whitish, very, very opaque. It's called sclerosis. And they have all these new bone spurs, or called osteophytes, as the body is trying to heal. And also deformities as well. These are things can be seen on X-ray easily. No, I don't think so. No, we don't really use blood tests to diagnose osteoarthritis. If you use blood tests, you know osteoarthritis because maybe one is suspecting another kind of arthritis. So you want to get through later. For example, rheumatoid arthritis. As I said earlier, rheumatoid arthritis is different from osteoarthritis. Rheumatoid arthritis is an autoimmune disorder where the body is attacking itself, and that you have to use some blood tests to help you diagnose that. First of all, I have to say there is no cure for osteoarthritis. There's no cure. So the aim or the objective of the treatment is to relieve symptom, maintain or improve function, and improve quality of life. That's what your quality of function of the hand. That's what you're trying to do when it comes to management of osteoarthritis. So there are non-surgical methods or surgical methods. We usually start with non-surgical. Non-surgical is usually activity modification. You know, the things that cause a lot of pain, modify the way that you do it. People use things like even heat compress, cold compress, heat therapy. There's so many things that people have used. One can use a splint that reduces the movement but still maintains function. These are some of the things people like splinting. Some kind of hand therapy to maintain movement of the hands. Then if you continue, then painkillers. There's some painkillers that also reduce inflammation, what is called non-steroidal anti-inflammatory agents. But when one takes that, one must also take something that protects the stomach because it can damage the inner lining of the stomach. Things like antacids that protect the inner lining of the stomach. And if it progresses, the other thing is that one gets is over-the-counter medication that you don't need a doctor to prescribe for you. So many of them are in the health food shops. Herbal remedies, they do work for some people. Just like glucosamine, chondroitin, turmeric, all these have been shown to work. In fact, there is nothing I haven't had. In fact, some people even come to me before and they say, like patients in their 80s or 90s, and say, how come you have so much arthritis? You don't have pain, your hands are moving well. And you know what they say to me? That they take a bowl of porridge every morning and it works for them. I would recommend that, but don't just, some people believe that's what works for them. So I've had everything. Another thing that I use as well is the intra-articular steroids. Steroids are injected within the joint. Now I can do that in the office. I can do it with ultrasound guidance or by X-ray guidance. And what the steroids do is reduce the inflammation within the joints. All this give temporary relief for weeks, months, so for some people for some years. It's temporary relief. Now when we've tried all this and there's still significant nuisance to the patient, then we'll resort to surgery. Now, surgery depends on the joint that's affected, but that is important to say there is no cure for it. Surgery only deals with symptomatic relief of the particular joint that is affected, and not the rest. In other words, if you had surgery here, you can relieve pain here, but the arthritis in the other parts of the finger still remain. They can still be causing problems. And the surgical options include things like fusion or joint replacement. Personally, I prefer joint replacement because it maintains some degree of movement. But when you fuse a joint, it means it loses its whole function. Now, there are people who will argue. Some people always do a fusion. Myself, I practically do a joint replacement all the time because it maintains some degree of motion because both of them relieve pain. But the joint replacement, it maintains some degree of motion at the joint.